Welcome to my channel, Outspoken Samantha. If you are new here, welcome. I would love it if you would hit that subscribe button. And if you're returning, welcome back. I truly do appreciate your continued support on my channel, and I hope that you are subscribed as well. Amongst all of the disasters that we are facing pretty much every day, whether things are metaphorically or literally burning to the ground in America, you may have missed the fact that there are people trying to bring back mask mandates. I know this is not some kind of weird replay of Back to the Future. It is 2023, and there are actually people that are still trying to justify wearing face diapers.
Great Scott.
First, we can all speculate the reason as to why they would be trying to make this happen, but I think that the bigger question is, why would anybody go along with it at this point? Of everything that we have seen, of everything that we have experienced, particularly over the last couple of years, we have come to this understanding and this realization, at least if you are sane and logical and paying any speck of attention to the facts and reality, that the decisions that are coming from the top down have absolutely nothing to do with our health and safety and wanting to preserve our well-being or look out for us. Of course, it comes as no surprise at any time that they are trying to implement policies and mandates that make absolutely no sense, but they just want people to go along with them without questioning. They tend to hit Hollywood first because, unfortunately, whatever comes out of Hollywood has far too big of an influence on the decisions that people make, and the people at the top down know this. And it's really unfortunate because Hollywood, of all communities and all cities and all groups of people, are the last people we should ever be trying to emulate or to look to for any sort of guidance whatsoever. That's not to say that COVID doesn't exist, because nobody is saying that. Nobody was saying that in the beginning. Nobody is saying that now. It's just the fact that, as we have seen and as we have had to learn more about how viruses work, we know that they don't just disappear and they don't just go away, but they do evolve and they mutate, and they might become more virulent, they might become more contagious, but they also tend to become less severe. Not to mention, there is a vaccine and about 27 different kinds of boosters available at this point, and everybody that feels that that was the right choice for them and that it does protect them, at least from severe illness, you are welcome to do and believe whatever you want. Everybody that wants to participate in that has done so. So at this point, what is the reasoning to cover your face or to believe that covering your face with just anything is going to solve anything or have any kind of an impact or protect you in any way? And then, of course, there's the beginning of the school year, where we all know historically at the beginning of every school year, kids tend to get more sick. We do see an uptick in flu. Now we're seeing an uptick in COVID. We're seeing an uptick in numerous other kinds of illnesses, because when the kids get into the classroom, everybody's touching everything. Everyone's wiping their boogers on things. Kids can't keep their hands to themselves. And we know that kids are not known for being the most sanitary human beings on the planet. So it goes without saying that every year at this time, even pre-COVID, people were getting sick. I know that in my family, every time my kids go back to school, within the first couple of months, we all circulate illnesses and flus and viruses, and we do the best we can to get through it. And we implement all of the protocols that make sense that we were doing before COVID existed, which is to wash your hands more, to rest, to get, to take care of yourself, to take care of your health, to stay home, to minimize your contact with other people, to pretty much do everything that we were told to do when COVID got here. But for some reason, everybody was acting like it was the first time they had ever heard of these things, these protocols that all of us have been following for every single illness throughout our entire lives, that suddenly this is what was going to save humanity. Anyway, there is this news story out of Dallas saying that there is an uptick in COVID cases and other illnesses, and let's just hear what they have to say.
Back to school can bring so much excitement, and it can also bring a lot of virus.
We always get an uptick in viruses in this season, and it's just important for people to stay vigilant.
At least 2 school districts in Kentucky have already announced temporary closures on their Facebook pages due to illness, but wouldn't say which. And reportedly, at least 1 school district in Texas. According to the district's online tracker, 10 staff members have active cases of COVID-19, which the San Antonio Express News reports is 23% of the district's staff. Morris Brown College in Atlanta now instituting mandatory masking for a 2-week period due to cases of COVID-19.
I thought it was interesting that they said that they had an uptick in illnesses, but they wouldn't say which ones. I'm not really sure why. Perhaps they're not testing, which is totally fine with me. But if they have enough people that are out of the building and not able to take care of the classrooms, then yeah, they're going to have to shut down for a couple of days, which is totally understandable. Of course, a college, a university, our liberal institutions are always going to be among the first as well to go along with whatever policies don't make sense, which is interesting because they are supposed to be turning out our most educated, yet they continue to fail to do that. Of course, we can always count on CNN to give us some enlightened guidance on our health, our safety, on accuracy, and to give us the most up-to-date and important tidbits of scientific information that we just can't get anywhere else.
I keep thinking this. When I see people with masks on, am I making a mistake? What should I do?
Yeah. Well, let me give you the good news first. I mean, if you look at the country as a whole, you look at the map of the country and look at the CDC recommendations, most of the country is considered low risk right now. It's mostly green. You have a few spots of yellow and a couple spots maybe of orange where it's high risk. But green means there's low hospital admission rates, which is really the criteria that they're looking
in the green area, which means if you live in the United States of America, you're safe.
For whether or not we should go back to masking. So let me just sort of break that down for you. If you're in a green area, it means the recommendation is not necessarily that you
the entire country is green.
Need to mask, but you still can mask for the points that you pointed out, Poppy, if you're high risk or you're gonna be around high risk people. I recently visited my parents, for example, in Florida. I wore a mask. I tested ahead of time, try and keep them safe. If you're in...
Did your parents get the vaccine? If they got the vaccine and the vaccine works, why do you need to cover your face and get all these tests and go through this entire charade just to go see them?
Lower categories, then depending on what you're doing exactly, there may be situations where you need to mask as well. So that is sort of where we are. We're at an inflection point, I think, right now. We talked to a lot of the experts that you guys know over the years. Peter Hotez, for example, he said he's gone back to masking.
If an expert says that you need to wear a mask, then they're not an expert.
Michael Osterholm said he's probably about to start masking. Jonathan Reiner made an interesting point. He said President Biden should probably be masking because he is 80 years old.
Wasn't he the one that went on TV and was so proud of all of the vaccines and jabs that he was getting? So you're saying that it didn't work.
He's considered at higher risk. But I think we're at this inflection point. Numbers.
And Joe's gonna be really sad if he can't sniff children.
Have been going up. Weather's going to get cooler and drier. They're probably going to go up a little bit more. Obviously, if you've tested positive, if you've been exposed to someone with COVID-19, those are other situations where you should mask.
Stay home, take care of yourself. Don't go out and hang out with a bunch of people like you wouldn't do if you had pneumonia or bronchitis or laryngitis or any other kind of illness. Do what you would do with COVID if you were sick with anything else. There's no difference.
Testing, and we got used to testing. It's been a while. I went and checked my test. They'd
You got used to testing. I didn't get used to testing.
expired, so I guess I need to get some new ones. How should we be using these tests, and do they work?
Flush them down the toilet. There is absolutely no reason to believe that anything that the federal government tells us to do at this point to keep us safe and healthy is actually meant for that purpose. After we have seen all of the disasters and all of the ways that people are suffering and dying in this country right now, when it comes to fentanyl, when it comes to open borders, when it comes to the rising of crime, when it comes to people not being able to afford to feed their families. We saw what happened in East Palestine, and those people still don't have clean water to drink, and they are living in a toxic wasteland, and Joe Biden to this day has not been out there. We have border cities and border towns that have been begging for help, that have been overrun and flooded with illegal immigrants for the last 2 years that nobody has offered help to. And now even New York City is flooded and they are being completely ignored. And now we have the Maui fires, and we are hearing numerous stories of people that have lost everything and are having to jump through hoops to prove to FEMA that they actually need help. And yet we're still sending billions of dollars overseas to help other countries with their crises, while people here are left with nothing. So again, I say there is absolutely no reason to go along with mask mandates at this point. And if you do, you have been living under a rock and you are too weak to say no. Let me know your thoughts on this in the comments below. I truly appreciate you watching, and I will see you in the next one.